Hey everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. And it's a topic that I'm excited to share with you because it's a topic that's really misunderstood when it comes to health, and that's fevers. What is a fever? Are they bad? Are they good? When should I do something? What should I do if I do something? You know, at what point do we look at a fever and really say, this is something I need to involve myself with? So let's talk about what a fever is first. A fever is a rise in temperature. Now the average, again, that's an average, body temperature is about 98.6. Where does that come from? Well, they take about 10 or 15,000 people that are non-sick, asymptomatic, and they say, hey, all these people feel relatively okay. Okay, well, let's do this. Let's check everybody's temperature, and the average of that was about 98.6 degrees. Now, we have to step back now. Just by saying that, we got to step back and say, why does my body have an optimum temperature, and does my body have to work at keeping it at an optimum temperature? So what I mean by that is, if I'm 98.6 degrees and you're 98 and you're 98 and you're 98 and you're 98, it's not an accident that we're 98.6 degrees, give or take. And we have to realize that if we're all sitting in a room, we're all 98.6 degrees, again, give or take, your body's making an effort to maintain that temperature for a reason. So that being said, if I look at my house, for example, and I look at a thermostat on my house and I set the thermostat at 98.6 degrees, my furnace, my boiler, my house will work really hard and manage its energy to try to keep the house at that temperature because that's the most comfortable temperature for the people of the house. Okay, so that's kind of what your body has. It has an internal thermostat to keep it at 98 degrees. So if I go higher than that, that means my body almost always, I know there's a couple exceptions here, but almost always, in general, the average person we're talking about is doing it on purpose. Somebody came up, went up to the thermostat and said, boom, 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 I want to turn it up a couple of degrees. So if we think of that now, why would the body or the intelligence, if we can think of that as a person, inside the house, why would the intelligence of the house go up and say, 98.6 degrees is the best temperature my body works at, or the best temperature my house should be at, but I'm going to raise it up a couple of degrees. I'm going to crank up the thermostat on the house a couple of degrees and make it warmer than normal. Why would it do that? That's the first question you have to ask. And when are the times that your body would do that? Well, when it does that, almost always is typically when we get sick. Now, that sickness could be the cause of a virus or a bacteria, okay, fungus, and so forth, okay, yeast, infection, and so forth. But my body will typically turn itself up on purpose when it's infected. So again, you've got to think about this. Now, wait a minute. My body innately knows, the intelligence of my body knows, hey, look, at 98.6 degrees is great. Why then would it say that 101 degrees or 102 degrees is better? It would deliberately do that. Why would it say 102 degrees is better now, right now, than 98.6 degrees? It's doing it on purpose. Why? It's called leukotaxis, scientific term. What it means is for every degrees of rise in your body temperature, you ready for this? Your white blood cell activity doubles. Your white blood cell activity doubles if my temperature goes up a degree. So if I go up 2, 3, 4 degrees, I'm quadrupling the effectiveness of my white blood cells. Why would I want to do that? Because I'm sick. So I got a viral infection or bacterial infection. I got a whole army of North Koreans, right, or Russians invading inside my body. Well, we need to get the Marines out and the Navy out and the Army out. We got to get them out. They work better on Red Bull, if that works, if that makes sense. So I'm going to give all my soldiers a couple of coffees with Red Bull, and what they're going to do is they're going to increase their activity, they're going to get hyper, and they're going to be able to produce more deaths of viruses or bacteria or yeast or fungus. They're going to be able to kill more of those things at a higher temperature because they work faster and more efficiently at a higher temperature. Okay? We know this scientifically. So step back for a minute and say, okay, my normal body temperature is 98.6. My body deliberately raised it when it's sick in an effort to fight off the infection. Why? Knowing this, why would you ever want to put the brakes on a fever? Why? Because subjectively, as a parent, I have 2 boys, it breaks your heart to see a child with a fever. They're lethargic, they hurt, many times they hallucinate to some degree, and it's just difficult, it's heartbreaking to look at your child and say, oh my God, he looks terrible, or she looks so ill, I just want to do anything. So then what we do is we give them pills. You know, you give them Advil, or you give them Tylenol or something else, some drug, some chemical, and you put it in their body to lower their temperature. And you know who you're making feel better? You, not the child. Because even though the child may come out of it and say, geez, I feel a little bit better, I look more comfortable, you've actually put the brakes. You've tied a rope around the feet and the arms of all your army so that they are now less likely to kill the virus and bacteria. You're making it harder for your body to fight off the infection. And as a result, many times you'll give palliative care chemically with a pill, with a Tylenol or Advil, but the infection tends to linger on much, much longer. And you don't mean it that way as a loving parent or grandparent or guardian. You're like, oh my God, I'll do anything to make them feel better. The best thing to do is step back and go, it breaks my heart to see Billy running a fever, but I also have total understanding now of what a fever is and why he has it, and I really feel 100% comfortable knowing that the best thing I can do is make him comfortable while he has the fever, not treat the fever. Because the fever is not something that should be treated. The fever is something that should be embraced. The fever is something that we should say, my body's doing exactly what it's supposed to do. Just like if I drank, let's say, a lot of alcohol, not that I've ever done that, but let's say you drank a lot of alcohol, possibly through a funnel in college, and all of a sudden you're like, oh my God, this is horrible, I'm going to puke, right? My body's doing something, even though I'm sick when that happens, I'm doing something very intelligently to get rid of the poison that I put in my body so that my body doesn't get sicker. That's the same thing that's happening with the fever. Your body is basically trying to rid itself of something that's toxic to its function. And the best way that it can do that is raising its temperature. It's extremely efficient, highly effective. The bug, the virus or bacteria, likes your body because it is 98.6 degrees. And because it's a single cell, as a bacteria, viruses aren't even cells, they don't have the ability to control their internal environment. So if you start raising the temperature of the body, you wipe out, just the increase in temperature will kill the virus or bacteria. Then you double, triple, quadruple the activity of your white blood cells. That virus or bacteria doesn't stand a chance. Now, height of temperature, you ready for this? 105.85. 105.85. I know, again, that's going to freak out. Guys, this is out of Johns Hopkins University. This is out of the Mayo Clinic. This is out of the Journal of Immunology. These are research studies that show that your body is deliberately rising its temperature, and it would rise it up to 105.8, but no higher, unless the nervous system got sick and it wasn't able to control itself. And then what it'll often do is it'll spike. So if you see these high fevers, you tend to see higher fevers in younger children because their immune system is immature. They don't have all the antibodies to fight off a lot of these infections. So what they do is they use a fever to take the place of their immature immunity. That's why you typically don't see high fevers in younger or older children or adults, but they're much more common in younger children. That's why. So if you see that high temperature in an infant, that's much more critical than that 3 to 6 month period, sometimes within the year, but thereafter you'll see 100, 200, 300, 400, 5 degrees, very common, and it's actually a very good indication that the body's doing just what it's supposed to do. So what we do is we step back and we say, okay, what can I do not to treat the fever? What can I do to make the body work as efficiently as I can? Now, as a chiropractor, we understand better than anyone that the nervous system is critical in allowing the body to function better. So we recommend highly, and I recommend to all of you, that if your child has any type of illness, bring them in for additional checkups. So bring them into your chiropractor to check them again, even though I know they should be going, a couple times a month or once a month to be checked regularly for any type of nerve interference. In those cases, you may want to bring them in a little bit more frequently to eliminate any nerve interference to allow their body to function as well as it possibly can. We got to make sure the child's very well hydrated with electrolytes, so a Pedialyte or something of that nature is very important. You're going to expend a lot of energy, and you're also going to expend a lot moisture in order for your body to regulate its temperature. You'll also see what they call spiking fevers. A lot of parents get confused with this. They see your child, they're running a fever, then they're not, then they are, and they're thinking, well, I thought they were better, but today they have. What happens is your body expends an enormous amount of energy to have a fever. So your body takes a break. So it's kind of like you. If you took a run and you're not used to running, you're going to say, oh, I got to take a break for a minute. Okay, now I'm ready to go. Your body does the same thing with fevers. It knows that 104, 105 isn't overall great for your body to sustain that temperature for long periods of time. So you'll see like a 3 or 4 hour fever spike. It'll increase, and then your body will almost drop down to a low-grade fever or normal temp, and then it'll spike again, and it does that again. Your body's so intelligent, it's doing it on a regular, periodic basis to get the army, okay guys, you ready? You took a break, you guys ready to go? Okay, let's go get them. And then it goes at it, it quadruples the activity of the white blood cells, it attacks the virus or bacteria, then 4 to 6 hours later it takes a break, and it goes at it again. So make sure the child is adjusted, clear of any nerve interference, any subluxation. That's critical. Number 2, make sure they're well hydrated. Number 3, normal clothing. You don't want to overdress them because sometimes they'll get the chills, which is good because they're evaporating and your body's trying to regulate its own temperature, but you don't want to underdress them either. So almost normal dress, make them as comfortable as they possibly can. Ice chips, Pedialyte pops, something of that nature, really important. Make sure their nutrition is good. High sugary foods, even juices, even though the juice is good, and it has a lot of nutrition, it's also a lot of sugar for your body, and we know that sugar slows down the activity of the white blood cell. That's why diabetics and people that have glucose or sugar problems tend to have weaker immune systems. So we don't want to give them sodas, and I see a lot of people talk about ginger ales and Coca-Colas, and very bad, very high in corn syrup, very high in bad sugars. But again, giving them a piece of an orange to suck on as opposed to a juice, which is totally saturating your system with sugar, much better idea. So again, light on the nutrition. Chicken broth, scientifically shown to have different molecular compounds in there that help fight off viruses more so than bacteria. But again, locate what's happening, identify that the child is having that challenge, and support the fever. Better way to word it, support the fever. Don't try to enhance it, and don't try to treat it. Know that the body's doing something far more intelligent than an Advil or a Tylenol, which are toxic. I mean, understand, guys, they're not good to take for anybody, let alone when you're sick. So, understand that isn't the way to treat it. The best way to do is support the body in those situations. Say, look, it's doing something far more intelligently than I know, so I'm going to allow it to do what it needs to do. Other than that, guys, remember, to keep your body healthy, you have to have good thoughts. You got to drink a lot of water. You got to get a good night's sleep. You got to do a little bit of exercise. Make sure that you, your mother, your father, your uncle, your cousin have a very healthy nervous system, allowing those messages to flow. Get to your chiropractor at the very least once a month, if not more often, to make sure your nervous system's working just the way it's supposed to. This has been Dr. Joe Borio with Change Your Health, Change Your Life. Have a great week. I'll talk to you guys in a week or so.